George Bush hates black people. At least that's what Kanye said 20 years ago on a live broadcast for Hurricane Katrina victims. And he wasn't wrong. And 20 years later, I think we can all safely say that Donald Trump hates black people also. But if you're a New Yorker, you already knew that. I had to bring my oldest child not once, but twice to the hospital this week for complications due to sickle cell. And just this week I found out that sickle cell funding and sickle cell research has been cut by the Trump administration due to conflicts with DEI. And I think we all know what DEI means. Black people. Donald Trump hates black people. And if you didn't know, sickle cell anemia is a disease that mostly black people or people of Mediterranean descent have. One parent has a trait, another parent has a trait, and there's a 1 in 4 chance that your child will have sickle cell. I've got 2 kids with sickle cell, and 3 of my daughters have the trait. Donald Trump hates black people. So at the age of 26, my oldest was kicked off of my medical benefits and my health insurance and relies solely on Medicaid and Medicare. Guess what else is about to get cut? Medicaid and Medicare, because Donald Trump also hates disabled people and hates poor people. At the age of 29, having and possessing a degree in creative writing and game design from Hampshire College, my oldest child has also had 2 hip surgeries due to necrosis of the bones, due to sickle cell complications, and now has those same symptoms in the shoulders at the age of 29. Fully disabled and relies on Medicaid and Medicare. Because Donald Trump not only hates black people, hates trans people, hates disabled people, and hates poor people. At some point, the people who voted for this person need to look in the mirror and say, yeah, we know this person is a racist. We know he's a bigot, but we don't care because those policies don't affect us. So we're going to vote for him. And elections have consequences. And these are the consequences that those elections have.
My name is Dr. Charity Oyedeji. I'm a hematologist and researcher focused on improving care for people with sickle cell disease. I received a notice on June 16, 2025, that my K Award, a 5-year, $750,000 federal NIH grant to improve care for people with sickle cell disease as they age, was suddenly and unjustly terminated despite strong scientific evidence and early proven results. The termination notice stated that research with equity objectives does nothing to expand our knowledge of living systems and are quote-unquote low return on investment and don't enhance health, and also are harmful to Americans. These statements are inaccurate and disrespectful for so many reasons. Sickle cell disease is a painful, life-limiting genetic disorder that can be inherited by people of all racial and ethnic backgrounds around the world. Sickle cell disease primarily affects black people in the United States. My research was focused on developing the first and only functional assessment and the first and only exercise program tailored to the unique needs of older adults with sickle cell disease called SickleFit. SickleFit is a low-cost, high-impact intervention that can reduce healthcare costs, can improve quality of life for this underserved population. Ending this project not only silences promising solutions for a neglected group of patients, but also sends a devastating message to future researchers that even life-changing, evidence-based science can be discarded without cause. My question is, what can be done to overcome these grant terminations, and how do researchers doing impactful work for underserved populations find a way forward? Thank you.